Hey team, Joint Man here. Today I want to dive into a fascinating and often misunderstood topic: marijuana and glaucoma, the true story behind the myth. Let's start with history. Back in the 1970s, a groundbreaking discovery linked cannabis to a reduction in eye pressure. Dr. Robert Hepler and Dr. Ira Frank first observed this while studying pupil dilation. Public attention skyrocketed in 1974 when Robert Randall, a glaucoma patient, successfully used cannabis to alleviate symptoms, eventually winning a landmark court case. The science behind cannabis revolves around THC, the compound that lowers intraocular pressure by reducing fluid production and improving drainage in the eye. However, CBD, another compound, has shown potential to raise pressure, highlighting the complexities involved. Despite these findings, cannabis isn't the go-to treatment due to short action duration and side effects. But there's hope. Researchers are working on cannabinoids' neuroprotective benefits and innovative drug delivery methods that promise safer and targeted solutions. In essence, while cannabis introduced new glaucoma treatments, future advancements may lie in specialized cannabinoid formulations that offer sustained neuroprotection without the high. Today's discussion on cannabis and glaucoma is a detailed video, data-driven analysis you need to understand the therapeutic effects and limitations of cannabis compared to traditional treatments. Glaucoma is a serious eye condition requiring effective, long-term management of intraocular pressure, IOP, to prevent vision loss. While cannabis can reduce IOP, its effects are short-lived, necessitating frequent dosages. This makes it an impractical and costly alternative to prescription medications like latanoprost or timolol, which offer longer-lasting IOP control with higher patient compliance. Cannabis, requiring up to 8 doses a day, can cost significantly more annually than typical eye drops or even surgery. Prescription drops can effectively lower IOP for about $100 and $500 yearly, with high compliance. In contrast, a therapeutic dose of cannabis may cost $8, thousands or $12 per year, and may not provide the continuous protection needed. The future lies in precision-engineered cannabinoids, like non-psychoactive eye drops. These innovations aim to isolate the benefits of cannabinoids without the drawbacks, offering potential 24-hour IOP control and neuroprotection without the high and frequent dosing of raw cannabis. In summary, while raw cannabis holds some promise, its practicality in glaucoma treatment remains limited. The focus should remain on developing advanced cannabinoid therapies that combine efficacy with cost and dose efficiency. Let's delve into the topic of medical consensus and celebrity perspectives on using cannabis as a treatment for glaucoma. The medical community, including major ophthalmological organizations, strongly advises against using marijuana for glaucoma. The American Glaucoma Society, for example, warns of its short duration, unpredictable potency, side effects, and lack of evidence supporting long-term vision preservation. THC, the active compound in cannabis, lowers blood pressure, which may inadvertently harm the optic nerve by reducing necessary blood flow. On the other hand, some well-known figures have shared their personal experiences with cannabis for managing symptoms. Whoopi Goldberg uses a vaporizer pen for headaches related to glaucoma, referring to it as a life changer. Similarly, rapper Fetty Wap uses cannabis for relief from the pain caused by pressure buildup due to congenital glaucoma. While these stories bring attention to the condition and its symptoms, it's essential to distinguish between anecdotal relief and evidence-based treatment. Organizations like the American Academy of Ophthalmology emphasize maintaining stable intraocular pressure with prescribed medications as the best approach to preserving vision and preventing the silent, progressive damage of glaucoma. The biggest challenge in ocular drug delivery is the eye's anatomy itself. The cornea is highly lipophilic, whereas the tear film is hydrophilic, making it difficult for hydrophobic compounds like cannabinoids to be absorbed effectively. Current science is turning to advanced nanotechnology to address this. Innovations like nanoemulsions encapsulate cannabinoids, enhancing their solubility and penetration through the cornea. Nanomicelles, with their self-assembling nature, offer improved stability and permeability for these medications. In addition, prodrug design allows cannabinoids to traverse the tear barrier by masking them in a water-soluble form that activates at the target site. Hydrogel composites, on the other hand, increase the drug's duration on the eye's surface, potentially reducing the frequency of doses required. As we look to the future, dual-action treatments are on the horizon. These aim to not only sustain intraocular pressure lowering, but also provide neuroprotection. Such advancements represent a significant paradigm shift, moving us towards a new era of cannabinoid ophthalmology. Our discussion on FDA-approved cannabinoid drugs and their applications in medical treatments. Today, we have to dive into synthetic and highly purified cannabinoids that have been FDA-approved. These drugs provide crucial treatments for conditions where conventional therapies might fall short. First, let's explore severe childhood epilepsy, including conditions like Dravet syndrome and Lennox-Gastaut syndrome. Epidiolex, a plant-derived CBD oral solution, has been approved to reduce seizure frequency, offering hope to affected families. For chemotherapy-induced nausea and vomiting, when standard treatments fail, drugs like Marinol and Sesamet are utilized. These synthetic THC forms reduce nausea by targeting specific brain receptors. In cases of appetite loss associated with HIV/AIDS, Marinol stimulates appetite, combating severe weight loss. On another front, chronic pain, multiple sclerosis-related spasticity, and post-traumatic stress disorder are areas where cannabis-based medicines show promise. Clinical studies suggest that these conditions benefit significantly from cannabinoids, leading to pain reduction, spasticity relief, and improved PTSD symptoms. In conclusion, FDA-approved cannabinoids and cannabis-based medicines exhibit substantial potential in treating various medical conditions, providing relief where it is needed most. We wrap up this series by unveiling groundbreaking research on peptides and marijuana as a co-therapy. This new study is not about ready-to-use products, but a transformative approach to reduce side effects and enhance therapeutic effects. The idea is to combine purified cannabis extracts like THC and CBD with peptide injections. This advances drug strategies such as chemical stabilization for molecular stability and targeted delivery of cannabinoids to specific disease sites, especially in the CNS. A core innovation in this field is using peptides to block THC's unwanted effects while preserving its pain relief. Researchers designed short peptides that interrupt negative interactions in the brain, improving memory and cognitive function when used with THC. Cannabinoids degrade when exposed to the elements, complicating their injection. Similarly, peptides break down in the body, requiring precise engineering to reach their targets unharmed. This motivates the development of new injection systems for stable long-term use. This revolutionary approach enables cannabinoids to be as effective as possible, landing us on the cusp of a new frontier in palliative care, where science meets nature for holistic healing solutions.